Hello and welcome to our patient education meeting. My name is Caitlin and I work for Dr. Amanda Sharp, who is represented in the photo. We're very excited that you're viewing this video today because I'm going to talk about something that's life-changing. However, I will warn you, the information we're giving you today is so valuable and exciting that once you know it, you can't unknow it, and you're going to want to tell everyone you know about it. So what we'll be talking about is a common health problem that's affecting millions of people, most of whom don't even know they have this problem, and that is a compromised airway in adults and children. So during this presentation, I want you to think real hard about yourself, your friends, and your family as we address some of the most common symptoms of a compromised airway. So symptoms of a compromised airway you'll see at the top of the list is snoring. I'm sure some of you snore, and if you don't think so, ask your partner. They would probably say otherwise. Some of you may have actually already been diagnosed with sleep apnea. What's so interesting about snoring is people think that it's just normal. Well, I'm here to tell you it's not. It's actually very serious. Next on the list, we have fatigue, drowsiness, and feeling tired. Now, I would consider a full night's sleep to be around 8 hours. So if you're sleeping for that long and you're still tired when you wake up, that could be a problem. We also have chronic sinus issues and swollen tonsils, ADD, ADHD, which we are going to talk specifically about that one in a little bit. Matter of fact, research shows that 70 to 80% of children with ADD, ADHD is from an airway issue. There's also dark circles under the eyes, bedwetting, for kids, which we are going to talk more about that one as well. But for adults, this would be waking up at least once almost every night needing to use the restroom. And then there's health issues like high blood pressure and heart disease and 2 times the risk for stroke. Diabetes, TMJ, popping and clicking, which can also be associated with pain and headaches. Crowded and crooked teeth before braces are extremely common in someone with a compromised airway. And these are just a few symptoms. So what is the common cause of all these symptoms? You'll notice in our tree here, here's a list of some of the symptoms we mentioned, plus a few more. And what's interesting is that all of them have in common a compromised airway. So before we get into the cause of a compromised airway, I think it's important for you to know what exactly is a compromised airway. So to help you understand this image, it shows us that the upper and lower jaws are a major part of our airway development. You can see that the upper jaw is not fully developed because it's pushed further back from the nose, and this will affect the nasal airway. In addition, an underdeveloped upper jaw keeps the lower jaw from fully developing because the upper teeth trap the lower teeth and the jaw cannot expand forward to correct the position. When the lower jaw does not fully develop and come forward, it impacts the lower airway because it's pushed back, creating a compromised or pinched airway. You can see in this image how small the airway is. So how did we get here? How does this happen? Let's go back to our tree. Let's look at our list of possible root causes. So possible root causes of an underdeveloped upper and lower jaw, we have soft diet, weak tongue, processed foods, weak orofacial muscles, or in other words, weak inner mouth muscles, low tongue position, tongue thrust, and little to no breastfeeding. So we actually really have 2 main issues here. Our tongue can be a big problem, but most importantly, it's our diet. And that starts at birth from day 1. So let's talk a little bit about what that means. Mostly because of our lifestyle, we no longer breastfeed our babies for 2 years, and we no longer eat a hard food diet. Instead, we nurse our babies on average for several weeks to maybe several months if we can, and then we give them bottles and soft food, like baby food, macaroni and cheese, and chicken nuggets. This is what we feed our children. So why does this cause jaw underdevelopment? To understand this, we actually have to go back in time a bit, 400 years to be exact. This is Dr. Robert Carissini. He's an anthropologist, and Dr. Kurasini has done a lot of research on the development of the human skull. Today, we're going to look at his fossil studies and his population studies. When Dr. Kurasini looked at human skulls from 400 years ago, he found that those skulls had bigger upper and lower jaws, and that there was room for all 32 teeth in those jaws. You'll notice, too, that there was very little incidence of crowded or crooked teeth. And 400 years ago, there were no orthodontists around to make those perfect smiles, and we didn't have bottles or Gerber. Now, if you fast forward to present time, very few people have their wisdom teeth, and if they do, they need them removed. And for the 28 teeth that are left, we don't have room for them without them being crowded and crooked. Dr. Kurasini also studied isolated rural populations, groups of people who were not exposed to things like processed foods and formula. What he found was that these populations breastfed their children for many years, and that they ate a diet that was compromised of hard, tough foods like dried meats and hard root vegetables. In these populations, they have very little incidence of crowded and crooked teeth, and they had perfectly formed upper and lower jaws. So here are his conclusions. Dietary consistency of breastfeeding and a hard food diet at a young age promoted proper bone growth or proper growth of their jaws. It's only when processed foods and a soft food diet were introduced that the result was an increase and the occurrence of underdeveloped jaws and crooked teeth. So Dr. Kurasini also observed as Western culture was introduced into these isolated populations, in the first generation after processed foods and soft diets were introduced, 50% of the population began to experience an increase in malocclusion, or crowded and crooked teeth. After another generation, this increased to 70%. And after the third generation, this jumped to 85%. So what does this tell us? This tells us that malocclusion is mostly acquired. This means that crowded teeth and underdeveloped jaws are not solely caused by genetics. It's caused by something else. It is caused by cultural change. So we now know most malocclusion and underdeveloped jaws is acquired. It is unique to Western culture, and that it's a key indicator of an underdeveloped airway. So this is what our diet from a young age should look like if we want our upper and lower jaw to grow fully, thus preventing a compromised airway. So you may be wondering, how on earth is eating carrots and broccoli at 5 months old going to affect the way my jaw grows? First, we have to understand the importance of the growth and development that humans experience when they're young. Notice from day 1 to 2 years of age, our jaw development is already at 55%. Then, by age 4, we're in the mid-70s for development. You're almost done by age 12. So what you do from the very beginning will dictate a lot for the rest of your life. If your 5-month-old is gnawing on a carrot, what do you think is getting one serious workout in the mouth? The tongue. So why is that important to our jaw development? Our tongue is like a retainer for our mouth. It's the scaffolding for our upper jaw. When your tongue is not strong and is not fully functioning because it's held down by a tongue tie or was not exercised properly to aid in the growth of your upper jaw, you will end up with a V-shaped Gothic arch and crowded crooked teeth, as you see in the first picture. When your tongue is strong and functions correctly, and you will have a beautiful U-shaped arch that has room for all of your teeth without being crowded and crooked, like you see in the second image. So how do you get a strong tongue? You exercise it. And the most important time to exercise your tongue is from age 0 to 2, when you have the most amount of jaw development. So why do kids' mouths look like this and 80% of them need braces? Because their diet at a very young age did nothing to help their jaw development. It actually did the opposite. They didn't have the hard foods to exercise their tongue. Instead, they had bottles that pushed their jaw back and created a lazy tongue, and then graduated to soft foods that also do not promote a strong tongue. Now, I have 3 children. Did I give them a bottle and baby food? Yep, sure did, because I didn't know about any of this, and neither does most of the population. So don't feel bad, because I have good news. No matter how much we've messed up our mouths or our kids' mouths, we can fix it. So how do you know if you have an airway issue? What are some things that we look for? I want to show you a video of what a compromised airway looks like. This is Eli. We didn't make this video, but it is a great demonstration of what a child or even an adult looks like when they are struggling to get air when they're sleeping.
Now he's holding it. That was holding it. He's still holding it. He's trying to take in air. There he goes. Okay, now watch. He's holding it. He's holding it. He's holding it. He's holding it. He's still holding his breath, and now he's going to gulp again. And there he goes. That was it again. And again. He's holding. He's holding. He's trying to, there he goes. So this has been 3 minutes and 15 seconds, and you can see how many episodes he's had of not getting calm breaths in. Now watch what happens when I take his jaw and I just bring it forward. If I can, let's see if I can. And I open his airway. Just bring his airway forward. Now listen to the quiet breathing. There we go. Now he's breathing through his nose. And I brought his airway. I'm opening his airway. Just pulling his jaw forward ever so slightly. And now he's breathing through his nose quietly. His mouth is a little bit open, but he's breathing through his nose. Just by hear how quietly he's breathing, you don't hear him anymore. And all I did is gently bring his jaw forward.
So if you have seen a child or an adult who looks like this, or even a mild version of this when they're sleeping, that's a problem. Now, this is obviously a severe case, but any snoring or sleep disordered breathing or breathing that is not effortless through the nose is a huge concern. So what does this tell us? You can see in this image how the lower jaw is pushed back, so the development of the upper and lower jaws has a huge impact on how we breathe. It creates a small pinched airway. So what should our airway look like? Well, you tell me. Would you rather have a straw-sized airway to breathe through or a garden hose? Which one do you think is easier to breathe through? Here's some 3-dimensional images of what a bad airway looks like with a description underneath of why. The colors show the amount of volume in your airway. White and blue is good, red is bad. And there is a lot of red. These people have a straw for an airway. So what does this look like from the outside? I'm going to show you some pictures of children. The first child, his name is Michael, and I want you to remember him because we're going to talk about him later. You can see how far his lower jaw is pushed in, giving him a double chin and almost really kind of making him look like he's overweight. The second child has dark circles under her eyes, dry lips, dimpled chin, lack of symmetry in her face. And the third child has double chin, dimpled chin, dry lips, dark circles. Why is this a concern? Because these are visible signs that you can see from the outside that are a result of a very severe compromised airway issue. And what's scary is an unhealthy child is just going to turn into an even unhealthier adult. Because what happens when we become an adult, we don't bounce back as good as we used to. Something else that we look for in someone who may have an airway issue is how do they breathe? Is it through their nose or through their mouth? And why does this matter? When you breathe through your nose, the air is warmed, filtered, and humidified. If your upper jaw is underdeveloped and causes an inability for you to breathe through your nose well, you have to breathe through your mouth. When you breathe through your mouth, unfiltered dry air is hitting your tonsils, goes into your lungs, and what happens is you can end up with inflamed, swollen tonsils, allergies, asthma, and all of these things, unfortunately, will impact your ability to breathe. In addition, nitric oxide is produced in your sinuses. Nitric oxide is a vasodilator, which helps our bodies absorb oxygen and helps with blood flow. When you breathe through your mouth, the oxygen is not mixed with nitric oxide, so your body does not absorb the oxygen as efficiently, and your vessels become constricted. So nasal breathing is very important for our bodies and for our health. This is how our bodies heal themselves. And we need to be able to breathe through our nose in order for our bodies to heal while we're sleeping. So now that we've established the importance of nasal breathing, when you have a child who is mouth breathing and has a small airway, it impacts how the child is able to sleep, and they may experience restless sleep, nightmares, and nighttime arousals. When a child does not get a good night's sleep, it impacts their life drastically. A common side effect of this is ADD, ADHD characteristics. I'm going to show you a video from Dr. Ben Maraglia, and he's going to share how airway and sleep may be linked to ADD, ADHD.
Now take a child, alter their quality of breathing and sleeping. And the real big issue now is how will they be during the day? So now you take a child who's 5, 6, 7, 8, it doesn't matter. Their issue has begun years ago. So it's not like you had 1 or 2 bad nights of sleep. You've had a poor quality of sleeping and breathing for years. And the parents have been struggling with so many different issues, and not the least of which is the ADD, ADHD discussion. Because the child who doesn't get a proper night's sleep with a good quality of breathing throughout the entire night is going to wake up and be unrested. And when you get a child who's had a poor quality night's sleep, poor breathing all night long, and you make that happen for years, you know what you've got? A 6, 7, or 8-year-old that's going to go to school and have trouble learning, have trouble sitting still, have trouble behaving, have trouble cooperating, basically have trouble fitting in to what is supposed to be a quiet and peaceful and learning environment. And it's not long after that where the phone call comes to the parent. And when the phone call comes to the parent from the school, what happens is, we have little Jimmy here and he's a little bit disruptive and we really want you to have him evaluated for ADD and ADHD. They're going to be diagnosed with ADD and ADHD, and our solutions are pharmaceutical. If we are given a pharmaceutical, it's usually in the form of some sort of a stimulant. And what that does to the child is it kind of pushes them over the edge and it brings them back to calm. So you basically take an excited or hyperactive child, you stimulate them more, and you bring them back to so-called calm. But it doesn't make a better learning child. You're not going to have a child who's able to learn as well. So now you might have the child sitting still in class because they might be a little more numb or relaxed or calm, but it doesn't necessarily make them a better learner. If we have the so-called ADD, ADHD diagnosis, we're talking about hyperactivity. We're talking about all of the things about behavior and development that land in this category. And the interesting thing about research is, and there is current, ongoing, and past research that shows, children who are sleep deprived produce the same exact symptoms as kids who are diagnosed with ADD and ADHD. In fact, there's a nice study that showed children who were diagnosed with ADD and ADHD were mixed with children who were sleep deprived. And in that group of kids, when they tried to analyze them and look at their symptoms and diagnose them, they couldn't tell them apart. And if you have a group of kids and you can't tell apart who's an ADD child and who's a sleep deprived child, it's no surprise that maybe the ADD and ADHD has a cause. And maybe that cause has to do with the quality of the breathing and the sleeping overnight. And there's a lot of research out there. And one of the pioneers here is Dr. Stephen Sheldon out of Lurie Children's Hospital in Chicago. And he does a wonderful job of researching, and over the decades, he's come to a conclusion, and I've seen him speak, and it's not soon after he jumps on stage and he makes a statement that ADHD and ADD do not exist. They are an outcome of a sleep disorder breathing. They're an outcome of a poor quality of sleep. It's all about the quality of sleep. Another researcher who's produced beautiful research on the same topic is Dr. Karen Bonnick out of Einstein at Yeshiva University. Dr. Karen Bonnick has the largest study to date. 11,000 children were watched over 7 years. And they were divided into two groups, sleep disorder breathing children and children who do not have sleep disorder breathing issues. The children in the sleep disorder breathing group, over their 7 years, her study showed that they were 50% more likely to be diagnosed with an ADD or ADHD diagnosis and treated with medication. 50% is a coin toss for our child to be diagnosed and treated with a medication. Also in her group, they were doing testing. They were doing IQ or intelligence testing along those 7 years. And the children with the sleep disorder breathing, their intelligence testing, their IQ scores were dropping over those 7 years. And that's really not the way it works when you're growing and forming. The formative growing years for a child, when they're sleeping and breathing well, your IQ raises to a certain point and then you kind of plateau. We don't see IQs diminishing amongst children.
So quite interesting. Now, something else that I want to also consider in identifying an airway issue is bedwetting. For adults, it would be waking up once or twice in the middle of the night needing to use the restroom. So how is a compromised airway linked to this? Again, I'm going to have Dr. Maragula explain the connection between bedwetting, airway, and sleep.
Another thing that might happen is bedwetting. Bedwetting, it's a little more common than people are aware because it's also a best-kept secret. Not many people are running around and advertising that their child is bedwetting at the age of 5, 6, 7, 10, 14 years old. But bedwetting does have a relationship to how we're breathing and our quality of sleep. And some of the causes for bedwetting relate to the way oxygen is exchanged in our body. And the way I'll describe it is this. If we're breathing through our mouth, that air coming into the lung isn't really filtered, warmed, or humidified appropriately, and the body can't exchange it appropriately. So a little less oxygen goes to the brain. Now, the brain is a very sensitive organ. When the brain recognizes little changes in oxygen, it goes to work immediately. Because once the brain starts to recognize a little less oxygen, it doesn't know if we're being choked to death, a very serious condition, or if there's an imbalance in how we're breathing at night, but it does start to trigger a little bit of the fight or flight response. And a little bit of the fight or flight response means the brain's going to look at the body and say, all right, if we've got a little bit of an oxygen issue going on, I'm going to pull oxygen from something that it picks to be unnecessary right now and maybe deliver it somewhere that might be more important, planning on a rare occurrence as if the oxygen was going to stop. So if the brain's recognizing a little less oxygen, all of a sudden it's pulled from the urinary tract. If the body pulls a little oxygenation from the urinary tract, it might void. So we might wet the bed.
So this process happens in children and adults when you're sleeping and starved of oxygen. In children, it's bedwetting. In adults, it's waking up from sleeping and needing to go to the bathroom. So the reason that we've talked more about kids is because that's where it all starts. As mentioned before, an unhealthy child would turn into an unhealthy adult. The big problem is the older that you get, the longer your body has to deal with your sleep disordered breathing, and sooner than later, you will start to experience symptoms like this guy.
I believe in marriage. I don't believe you have to sleep in the same bed, especially the older you get. I was cool up until young 40s. Now I'm okay, because she wakes me up every other night. I swear, once a week, I get woken up dead sleep. Get up! What? You're going for a sleep apnea test. You stop breathing. You snore to the point that it's borderline violent, and then you stop breathing. You stopped breathing for almost 3 minutes, and I was contemplating on letting you pass away to prove a point that you never listen to me. You don't trust me. You don't trust me.
Now, unfortunately, why this is so funny is because it's so true. Many people experience this. And it's funny because it doesn't even look like this poor guy has a chin. So I'm sure he does have an airway issue. Now, if we go back to our list of symptoms, notice that I added a few more to the list because I want you to understand that finding someone with a fully developed upper and lower jaw with an appropriately sized airway is like finding a unicorn. And now you know why. I want you to look hard at these symptoms because all of these have a common cause, and that is a compromised airway. Now, at this point, I'm sure all of you are either thinking, I have a lot of these symptoms and I'm a hot mess, or you know someone that does. So how do we fix it? Well, it might not be what you think. What is the essential role of a dentist? How can we help you? What if I told you we have a non-surgical solution using a dental device to treat a ton of medical problems? Let me show you some examples. This is Hunter. Hunter actually struggled with bedwetting. Now, when you look at his teeth in the first picture, he has a deep overbite and no room for his permanent teeth to come in. Now we know that this is a sign of underdeveloped upper and lower jaws. In the second picture, this is what he looked like 10 months into treatment. And he stopped wetting the bed after just 1 week in treatment. Why? Because he was able to breathe better and sleep better. This is Paige. Paige also had a deep bite and a lot of crowding. This is what Paige looked like after treatment and a beautiful, remarkable transformation. It's amazing, actually, if you look at what her profile looks like, how different this is. Now, do you remember Michael? This is Michael at age 9, and then at age 14 after treatment. It's amazing if you look at the difference in Michael's teeth before and after. But even better than that, this is what Michael's airway looks like before and after. In the left, you can see the straw of his airway, and then in the right, that's the garden hose that we want. So, of course, after we were educated, I was the first one to jump in on treatment. This is me. Now, the concerns that I had for myself was waking up unrested, feeling tired throughout the day. I was constantly biting my cheeks, my lips. I had chronic sinus congestion, sinus infections. We did do a home sleep test on me, and mine did come back very mild sleep apnea. But I'll tell you, the biggest reason why I wanted to do treatment was I hated my smile, and I wanted a natural way to straighten my teeth. So in these photos, you can see my concern being that I am in the dental field, I need to represent my field well. I was always self-conscious about my smile, my crooked teeth. You can say I have a V-shaped palate. My teeth were tipped in towards the center of my mouth. This really shows how having an underdeveloped jaw affects the way your teeth come in. And the thing is your adult teeth have to come in somehow, and when there's not enough space for them to come in straight, they're going to come in crooked, and this is a prime example. So for my treatment, this is the appliance that I wore a little over a year. The upper one is much like a palatal expander as well as the lower, because the springs in front of the appliance stimulate stem cells in the palate and the ligaments of the teeth, which enable you to grow and expand the upper and lower jaw by turning the mechanism in the appliance. You can actually see the separation in the acrylic on both my upper and lower appliances. Now for the results. So I'm very happy with my results so far. This took a little over a year to achieve, and I can confidently smile now. My bite feels good. I don't bite my cheeks. I don't bite my lips anymore. But better yet, I feel better. I did take another sleep test at home, and it came back 0. Absolutely nothing. No sleep apnea whatsoever. And it's funny because I actually didn't even know how bad I felt until I felt so good. And here is why. I was diagnosed with upper airway resistance syndrome, where most of my issues were actually my upper airway and the sinuses. I used to get sinus infections chronically about 2 to 3 times a year. But ever since starting my oral appliance therapy, I'm going on 2 years now, I have not had a single sinus infection. You can see how tiny my nasal passages were in the left picture. They're very pinched, very narrow. And then you compare that to the picture on the right, which you can see how much larger my nasal passages are. And this basically allows for better draining. I don't get sinus congestion, and this also helps promote nasal breathing. Now, I thought I would be happiest about my straight teeth, but that ended up just being the icing on the cake, because what I'm most happy about is how I feel. I feel so much healthier, I have more energy, and I know that my quality of sleep has improved immensely, and I'm a really good nasal breather, which is super important. So how do you get your treatment? Where do these appliances come from? The dental oral appliances that we make for our patients is through a company called Vivos. Vivos has developed a proprietary multidisciplinary treatment protocol utilizing a series of diagnostics and specific oral appliance therapy for each individual patient. With these oral appliances, we expand the dental arches, which help promote nasal breathing, which you've now learned again how important that is. It grows the airway, corrects tongue positioning, eliminates bad habits, and reverses the effects of these bad habits, like thumb sucking and a tongue thrust. And by expanding the jaws, this allows for more space in the mouth for crooked teeth to correct their position naturally. And because we're utilizing your own stem cells, this is possible for anyone of any age. Vivos is a treatment system made up of screening, medical imaging, diagnostics, personalized interdisciplinary treatment, and biomimetic oral appliance therapy. Matter of fact, please visit vivoslife.com for more information and research specifically on this. And I would like to conclude by showing you one last video.
I really feel like Vivos is one of the great answers to the healthcare crisis that's in America, because we're getting to the root cause of what ails a lot of us, and that is not breathing well and not sleeping well.
If you trace back the journey of a sleep apnea patient, that patient is suffering for years before they ever get diagnosed. Once they are diagnosed, they're presented really with two fundamental options. You can go into CPAP and wear a contraption over your face every night for the rest of your life, or you can have what's called a mandibular advancement device, which will actually protrude your lower jaw in an unnatural position to hold your airway open while you sleep, and you can wear that for the rest of your life. Either of those two modalities are going to present that patient with a life sentence of having to wear this contraption, one or the other, every night for the rest of their life.
The interesting thing about CPAP and oral appliances is, although they're very effective treatments, if they're used over a lifetime, the person's condition actually gets worse over time.
Along comes Vivos and says, wait a minute, we have a better option that's all natural, non-invasive, non-pharmaceutical. We can say to a patient, you go into this oral appliance therapy with our protocols, and you go through this treatment for 12 to 24 months. And at the end of that time, there's a high probability that you will no longer have to wear an appliance or any kind of device.
Vivos is literally changing my patients' lives.
It has drastically changed my life. I don't have to use the CPAP anymore. Within just a couple weeks of using the appliance, I was able to breathe through both nostrils, something I couldn't do my entire life. This was revolutionary. Pretty much made me feel excited about life again.
She's sleeping better, I'm sleeping better.
You really feel like you've been given a new life.
It's amazing. I wake up and I'm not in pain.
Because she's sleeping better, is her attitude during the day is better.
I have a better quality of life now. I can't say enough good about it.
I'm getting instant benefit from it. I was amazed. I dreamed every night for 2 weeks straight, and I told my wife, I said, it's amazing. I feel sharp now. I don't feel drowsy all the time. It's been a long time since I felt this good. I wouldn't lay down and try to sleep right now without my Vivos device.
My asthma has gotten much, much better. Without the Vivos, I wouldn't be outside right now. There's no numerical value you can put on this kind of a change. I smile and I haven't smiled for a long time.
Right after I started using it, I noticed the results really, especially with the snoring. My sleep apnea episodes are a fraction of what they were before. This product's phenomenal. It changed my life.
It's a very comfortable process, but I can see dramatic differences. Now I can really open my mouth. Before it would almost always click.
His ADHD is calming down, he's doing better in school. I can definitely see the difference and the change in him. It's a miracle.
I get to do things now that I would not have been able to. I would not hesitate to do it again.
I am 100% happy that I did this, and I'm thankful every day that I have it because I can breathe.
We bring hope to the millions of people and the millions of families, men, women, and children who suffer from this disease.
It promotes the body's own ability to heal itself because now the body can breathe and sleep well. That's exciting.
So thank you all so much for taking the time out of your schedule to watch our video and become educated on this. Who knows, you may save your life or someone else's, and we would consider it an honor to have you in our practice and make a big difference in the quality of your life. So if you have identified that you or someone you love are a candidate for this treatment, please definitely give us a call. You can see our phone number on the screen, or you can email us at drsharp@manateefamilydental.com.